for the last 13 years of my life, I've been having neck pain. Why are young people like me having pain for such long periods of time? This is not my age.
Your body means to live easily till 70 without any problem. This aging started up. My 50% of the client, I'm never recommending to go for MRI and X-ray. If you do a lot of MRI, X-ray, some cases because of over radiation can also cause some cancers. 80% of the people, they have a headache, which is relevant to neck.
I never imagined that stress can have something to do with neck pain. Pillow would change if you're a straight sleeper, if you're a side sleeper. Some people sleep without a pillow.
If you sleep without a pillow today or tomorrow, you mess with your neck.
Because I've consulted multiple physiotherapists. They just say, stop going to the gym. How relevant is that advice?
Ideally,
I see normal people cracking their necks, and that scares me. I've seen two things happen. Someone feel better, and in movies I've also seen people dying this way.
that is a lot of hype. Young people, they have a problem in the neck. Young people, they are going gym.
When should that person who's having neck pain stop going to the gym from your experience?
Stop going to the gym, superficial state.
The teaser you saw right now is my conversation with Dr. Ravi Khamar, who's a leading physiotherapist based out of Dubai. He has treated over 5,000 patients suffering from back and neck pain. Now, why did I do this podcast with him? Because this podcast was very important for me. I have been someone who has been suffering from neck pain for the last 14 years of my life. I did something wrong in the gym. I did not take care, and khalas, since then I've been having a neck pain. In fact, I'm having neck pain right now as I'm speaking to you. However, and with the help of Dr. Ravi, my neck pain has gone down by 70%. So I am someone who's had so much pain, but it has become so much better. I've been undergoing physiotherapy with him since the last couple months, and I decided, hey doctor, the knowledge that you have needs to be shared. The way you explain complex issues, no other doctor can. Because trust me, I've been to so many doctors before, so many physiotherapists, but no one can break down the information the way Dr. Ravi Kamar has. And his center called Movement on Physiotherapy Center is the best physiotherapy center that I have been to, and I can personally attest. You will see a lot of videos of all the treatments that's happening on my own body throughout this podcast. So sit back and enjoy, and don't forget to like, share and subscribe, because we will keep on bringing you more such value addition content. And if you're someone who's just started to suffer from neck pain, or who has been suffering from neck pain for a very, very long time, this podcast is going to be incredibly valuable for you. Share this podcast with your friends, family, relatives who are suffering from neck pain, because the information shared in this podcast will help them a lot to overcome neck pain and live a better, happier life. And without any further ado, over to the episode. I'm 30 years old right now. Okay. And for the last 13 years of my life, 1-3, I've been having neck pain. It started when I was close to 17 years old, back in college. The multiple reasons why it came. I started going to the gym at that particular age. I didn't have money to afford a personal trainer, so I would look at workouts online. Even when you're going to a gym, if you're not signing up for a workout program, they will design a workout program, but they don't specifically monitor you. So I would think like, okay, wow, I'm building muscle, I'm doing everything right. But I think in the process, I messed up my neck. And recently I met you. I've started taking physiotherapy from you. The pain has gone down significantly. So first of all, I want to thank you for that. You have managed to reduce the pain, someone who's had pain for 13 years of his life. So you have managed to reduce it by 60-70%. And for me, that's a massive thing. And as I'm working together with you, I'm sure that the pain would go down much more. But doctor, I want to know from you, why are young people like me having pain for such long periods of time? This is not my age to have pain. As a 17-year-old, as an 18-year-old, I should not be having neck pain. I should be enjoying life.
It is very burning question right now for all the youngsters. So first of all, we need to understand why these neck pain are so common. The very single answer about it is the lifestyle and lot of gadget use. Mobiles like 1 hour, 2 hours, they are in the desktop, workload is there, stress is there, and they're not even taking a single break. So that is the first and foremost burning problem right now we are facing in our professional lives as well as personal lives. So that's the one thing I would like to address. And that is why people are getting a neck pain.
Okay.
And there is something relevant to the anatomy of your back and in the spine. So your spine has some of the segment and people are not aware about that. If you train it right, if you manage it right, your body means to live easily till 70 without any problem. Believe me, this is bold statement I want to give you.
Now, you mentioned that leading cause of this is device use. People are on their smartphones. So when they're using the smartphones, people generally bend this way. I read a stat saying that for every 10 degrees that you bend your neck, you're adding 10 pounds of weight on your neck. So if I'm bending my neck by, I think, 60 degrees, there's basically a 60-pound weight added to my neck, or 30 kilos, approximately 30 kilos. Talk to me about this, doctor.
So when you bend it forward, your neck, okay. So usually what happens, your neck is like that. That is a simple curvature is there in the neck. So understand, when you have this curvature, this is the God has given you simple curvature. So when you bending forward, so some kind of the extra weight your muscle has to bear. At the same time, your main important structure in your neck and in your spine, that is a disc. So basically, this disc is like working like a jumper. It's a working like a shock absorber. But now any car, or if you keep on jumping. So there is a limit for shock absorber. So what happened when you bend it forward, it is not in a proper alignment. And if you continuously do, it is not having a resting phase. So ideally, suppose some person working for a long hours. I want to give you very simple example. Like I'm working for a 5 hours, 6 hours. I know I have to work or I have to use the gadgets. So ideally, I will give a very simple advice to this kind of people. Keep a timer or whatever you have in your device. Whenever 1 hour is over, just try to take a break and take your neck back and just move left and right.
Okay.
So this significantly reduces the stress accumulation in your disc and the muscles, which is there in the neck. So this is a simple but very effective technique that people has to use.
Many people these days are on their PCs, on their mobile phones. So after every 1 hour, even if you're using use, that's fine because we can't avoid it. That many people are having jobs in social media, including my own company, which runs on social media, right? Being on the phone pays us, it pays for our bills. But what you're saying is just tilt your head back, and what is the next thing you asked?
Okay. Ultimately, you just take your neck back. Okay. Straight, upright.
Yeah.
Take your neck back.
Okay.
As much as you can do it.
Okay.
Then you can take your hands with that if it is possible.
Okay.
Okay. And try to touch your both the elbows backside, head up, and just move left, right, keeping the neck back. So this particular movement, if you feel some relaxing effect.
Very relaxing.
And why this is happening? I'll tell you the scientific reason. So mainly this neck actually has the base here.
Can you show it with this particular thing? I think I want you to explain this to the young people because they don't understand how the human anatomy works. Okay, so I'm going to give you something which is from the movie Harry Potter, just to make it easy, just so you can describe the structure.
Okay. So first of all, I need to describe basics of the spine. So that would be much better for the people to understand. So this is your full spine. There are so many segments. This is a cervical segment. This is thoracic. This is lumbar, and this is sacrum.
So there are 4 segments. In the
yes,
spine.
4. Okay. Ideally, there are 5.
What are the 5? Can we go again? What are the 5 segments?
Sure. So cervical means neck part. From the head till your shoulder level. From shoulder till your tummy. Okay, there are thoraces. Okay, then after that there is a lumbar, that is your back areas, and after that your pelvic area, it is called as a sacrum. Sacrum is fused bone, 5 vertebrae fused together.
Okay,
and the last, that is the tail. In our ancestors used to have the tail from that.
You mean the monkey tail, right?
Monkey tail.
Okay, so
this is coccyx. This is coccyx.
From the coccyx. a monkey
tail
the
has started.
tail would do.
But now as we evolution happens in the human like evolution period, so this tail and now is become like inappropriate and now it's stopped here. It's not growing from there. The
Interesting.
gene of that one is not like designed to grow there, so it stops here. So that's why we're able to stand upright.
Got it.
So now this is the basic structure of your spine. Now after that, all this segment, whatever you see here, these all are the separate bones. It's called as a vertebrae.
These
And
bones. One,
yeah,
two,
this
three.
is the whatever. No, you see this white,
Yeah.
white. Now all these bones basically are separate, and they united with one unique structure, like in between that. That is called as a disc. Whatever
Correct.
you see
Which
here.
you were speaking about earlier.
Correct.
These
Yes.
transparent.
This whatever you
shapes
see,
over here.
that's a disc.
Perfect. Okay.
Okay, and this disc is actually very unique structure in the body. If anyone understand about the disc, so automatically they understand why these pains are happening, and if you know how to manage, you can also prevent that. In the body, whatever structure we have, they are flat structure. Like bones are kind of hard structure, muscle are kind of flexible structure. But only two structures are in the body, they having kind of the effect like a rubber,
Okay.
or they're providing the shock absorption. So first in the disc, in the all the spine, okay, you can see this one. So disc has that capacity to just decompress and compress. So if you put the weight on it, like it's a structure like a pillow. Like if you put a pressure on it, so what happened, like disc can compress, and if you release the pressure, it can go decompress.
Got it.
Okay, so this disc, we have three interesting fact about the disc. Suppose we cut the disc from the transverse view, and if I put the disc in front of you, there is some kind of a liquid is there. Okay, now who are watching, I just want to tell them, just try to understand that in the depth. If you understand this secret, you can prevent almost around 80 to 90% of your back pain, which is supposed to happen in the future. So that kind of bold statement I want to give you. So there are three important facts about the disc that you need to understand. So suppose I'll ask you, any person, what is the age you feel your body started to age? So usually, normally, like people, like suppose in the females, we know the menopause is 40, 45. In the male also, after the 40 or 45 or maximum by 50, they feel like their health is deteriorating, they starting the aging. There is not that much power. So the aging process of the human body usually start at 40 or 45. Okay, but important fact about the disc aging process start at the age of 22 to 25.
Oh wow.
That mostly people doesn't know. That's interesting fact. The second fact, so in the body, if you know, like people, like in the smallest cells, we have blood vessels. The blood is pumping from the heart, it's going everywhere in the body. There is even this single cells in the nails also. In the micro level, they have capillaries. The small blood vessels is called as a capillaries. Okay, so kind of blood pipelines. Consider that way in the layman term. So every single part of the body, they have blood vessels. And interesting fact is that in the disc, there is no direct blood supply. You must be thinking, why like that? Because this is very important structure. So why God has created that way? Okay, that is a curious question, but there is a reason for that. I'll come to that part as well. And the third important fact you need to understand, like suppose you have a cut. Okay, let's assume suppose you have.
I have a cut here.
Oh, see. Okay, so when did you have that? Might be, I guess, 1 week before.
Actually, just yesterday. Just yesterday.
Okay, so believe me, like you also know, you experience, like after 2-3 weeks, if you do anything, if you apply bandage, if you don't apply bandage, whatever, within 3 to 4 weeks maximum, you will have a new skin.
Of course, yes.
Okay, you're not conscious about that. Body is meant for a healing if you provide condition, apply proper atmosphere.
Body is made for healing in the right atmosphere.
Right atmosphere. Okay. And our human body software, that human body is the hardware, and the software which is running is meant for healing. Anything wrong happens to your body is always to try heal. Okay, so this normal healing process of any body structure that starts from 4 weeks till 8 weeks or 12 weeks.
Starts from 4 weeks?
4 weeks till the 8 to 12 weeks.
You're saying it takes 4 weeks to 8 weeks.
But
it starts immediately.
It starts immediately,
okay.
And it completely heal within that time frame.
Okay.
So consider, let's take it very simple way. Like any healing process happens to any tissue, that usually takes from 4 weeks to 8 weeks. Okay, some bones breaking very hard might take more longer time, but let's not take that example right now. So 4 to 8 weeks is a normal time frame for any body structure to heal. But interesting fact about the disc healing. So whenever disc is injured once, it takes almost around 6 to 9 months to completely heal.
Oh, wow.
Let's revise 3 facts about the disc. The first, aging process.
22 to 25-year-old.
Okay,
Starts
wonderful.
aging. Yeah.
The second one.
There's no direct blood supply to the
And the
disc.
third one.
It takes 6 to 9 months to heal completely.
Okay. So now, if you understand the second one, okay, you're able to tell why third is like that. What is the second one?
Second one is saying there's no direct blood supply to it. And normally, whenever healing happens, I think more blood goes to that particular place
Absolutely.
and it heals. But disc is a place where if blood cannot even go,
Yes.
how
No,
does it
not
heal?
even go. There is no direct blood vessels.
Yeah, if there are no direct blood vessels, how can it even
Yes.
heal?
So that is the reason disc is taking a lot of time to heal.
Isn't there direct blood supply in the most important part of the why is it?
You do a lot of activities and your disc is continuously under the compression and decompressions. So when there is a blood vessels, what happens usually all the day, the blood vessel will rupture. And all the day your disc under bleeding.
Okay, so if you're completely working out throughout the day playing
so
some
there is
sport,
always some kind of no jumping activities happen whole the day. Even like no, I'm suppose I'm lifting from here, I'm lifting something, there is a pressure is going.
okay, even if you're picking something
Yes.
up,
there is also little pressure
of
is
course, yeah.
putting there. Okay, so all the day if you do all the activities and if you have blood supply or small blood vessels, all of the day there is a bleeding inside the disc. So that is the reason the God has not given the direct blood supply to this structure.
And if there was blood, your body you'll have internal bleeding, which is just happening. It's
There is
interesting. And imagine this, doctor. Right now, you're saying that we have this very interesting structure called the disc, which enables us to do a lot of things. Right? It doesn't even have blood capillaries, like you said, so that we can do these active. What if the human body didn't have discs? What would happen then? Would it just be a full blood flow inside the is that what would happen, or it would, or we couldn't even move as we could? What's the impact? Imagine I take out all these discs.
Before to address this question, I just wanted to finish it something about the nutritions about the disc. Why? Because if I'm not able to tell that one, the people will not exactly understand what happens if it's no disc. Okay, that is a relevant question to that. So you might be wondering, every body or any cells in the body, they have a blood supply. So in our language, in the medical language, it's called as a nutrition. But in layman language, suppose you are eating food, right? You need some nutritions, you need some energy. This is the way the body is generating energy and gives the actions and the whatever is it. So in the disc also, there is energy, it needs to be supply. There is nutrition has to reach there. So how this nutrient system is working in this system, that you need to understand.
Correct.
So how?
Because if blood cannot reach,
yes.
So what is that thing that could could heal it? Like
yes.
Even if it heals in 6 to 8 months, what is it that's healing it? That we need to address. Correct.
So I mentioned in the disc, if you say like there is a middle part is called the nucleus pulposus. Right? So this nucleus pulposus has some kind of a nutrients. Okay, it's kind of the nutrients, it's kind of working like a blood. Consider that way. But usually whenever you do jumping, walking, or so many activities, suppose this disc, whatever you see, this is the bone and this is the bone. So one level up, there is a bone, low level, there is a bone. So these bones have the normal blood supply. Okay, and whenever you do any jumping, even just a normal pressures coming on the disc, so disc is working like a shock absorbent and it's working like you can like sponge like. So it sucks the nutrients when there is a pressures coming, and that all the nutrients is accumulated in the center part of the liquid. And nowadays what happened, suppose these nutrients are there, but I told you there is no direct blood supply, so there is no blood vessels. So surrounding part of the disc also we need to reach these nutrients. So logically, okay, let's take example. Okay, can I have a water bottle or something here? That would be more relevant. This is a liquid in the bottle and that is also liquid in the disc. So if I need to make this liquids to reach all the area, what I'll do, I'll shake the bottles,
Correct.
I'll move the bottle from all around, and it's reach all the part. Simple logic. Same way, so ideally if you move your body left and right, so all the disc is going to move left, right, up, down. So this liquid is also going to reach in some particular areas, and that is how the whole disc is getting its nutrients.
Interesting. So the body requires movement. So if you don't give it movement, if you don't exercise properly, maybe, or if you don't go walking, then you're limiting the disc, is what you're trying to say right now. What are things that you can do to ensure that the most important thing that you're saying, the disc, is receiving the proper nutrition from your side?
Okay, so science is very simple, but for that one, what I can do, there are very basic understanding for that one. Ideally, you need to move your spine in all the direction.
How do you do that?
Okay, like up, down, neck movements, left, right. You can rotations, you can move the shoulder. So automatically that your full spine is going to rotate. And if you want, I can also, because on my channel already, there is a video, basic simple exercises that you should do daily for the neck pain, or even if you don't have a neck pain, just to know have the good nutrition to your neck disc level. So we can put it, and that exercise just hardly takes 2 minutes. If you just follow that one, 80 to 90% chances are that you will not have a neck pain.
I wish I knew it 10 years back, but I think even right now, people are not aware about this. The knowledge, the education is not there at all. But go on, doctor. You were saying, so this is the best way. They follow those exercises. And how often should they be doing those exercises?
Ideally, whenever you doing these exercises, the best time is when you wake up in the morning. Why? Because when you rest, automatically the disc liquid is jammed at the one place. So the nutrition system of the disc is working with the movement. So when you wake up, mostly people after the some age 40, 45, they usually have a neck stiffness. They usually complain, no, my neck feels stiff. And when they start the day, automatically, when they move a little bit or something, like they go for a washroom or brushing, automatically they feel good. So ultimately the best time is just to do the like in the morning. And as I told you, if you are working like your occupations is like all the day computers or gadget or something like that, every 1 hour, that one simple exercise that you just need to do.
Perfect.
That is the simple solution.
And I want to take this conversation a step further. For 7 to 8 hours, however long they've been sleeping on a pillow. What is the right posture that someone has to sleep? Because this is a way it's aligned, right? And what I'm getting from this particular conversation is it always needs to keep moving, right? It needs to keep moving, but at night you're not moving. You're stable. How do you ensure that you're not messing up your spine or your disc at night when you're sleeping for such long periods of time?
This is very good, interesting question, because now out of 10 client or patient I see, 8 people, they're asking the same questions. What should be the height of pillow? Okay, so I can just break down to very simple solutions. Okay, so can I have the spine? So ideally, this is the normal alignment of your spine. Okay, so this is the front part, this is the back part. So this is like that.
Right.
Okay, can you that? Okay, this is that way. So whenever you're lying down, ideally your spine should be in a neutral position, the how God has given us. Okay,
And this is neutral position.
this is the neutral. And let's take about the neck. So next, suppose the person is lying down, you can see this little bit hump here, like this curve. So if you put the pillow, automatically you are justifying, and pillow is coming here, by the way, near the neck and this one.
So pillow is absolutely needed.
Absolutely needed. And
But
if
some people don't sleep without pillow.
if you sleep without a pillow today or tomorrow, you mess with your neck. Believe me, because I have a client. This is the old myth. I don't know how it come, but no, as the research is coming more and more, we are going to be more advanced. So ultimately, like not having a pillow, 80% it's not going to work.
It's absolutely needed to
Needed.
ensure that
The
the
alignment,
alignment is proper.
proper. Suppose this person is lying down, and if you put a pillow, so then only he's going to maintain his neck curvature, because your neck is this one, and mostly we keep the pillow and little bit half of the neck is coming. So if you keep the pillow, then only this is going to maintain. If what happened, suppose this is the neck, this is your head. If you keep the pillow, it is going to be stable like this. If you don't put a pillow, it is going to be like hang forward.
Okay, so it's going to be like this
Yes.
position for a very long time
Yes.
throughout the night. Got
Okay,
it.
so in that, what happened? There is extra pressure happening to your disc, as well as behind the disc, there are some of the joints is going to be locked. that is called as a facet joints. When this facet joint is locked, okay, and just beside to that, these are the nerves are coming.
These yellow things are nerves. Okay.
So what happened when you lying down like this way, there is an extra compression is coming on the disc, your facet joints and your nerves. So when you wake up in the morning, definitely you feel going to be feel stiff. This is the if happened. So ideally the pillow is required.
But see, doctor, here's the thing, right? So I think even when you're getting a pillow, the right size of pillow matters. And this size would depend on whether you're a straight sleeper, like you said, but not everyone sleeps straight. It's a very tough position to fall asleep in. Most people sleep on either side. They favor one side on their
One-sided.
left side or their
Correct.
right side. And then some people sleep on their backs. And then some people are who, like, I don't know, they have their leg. And I used to sleep like that for a very long time when I got my neck pain. I think that is also another issue, which I've stopped doing that completely. But you know what I mean? Like on your back and with your legs spread out this way, I think that's also something that's very common. That's a very comfortable position in which you can fall asleep. The first one that you're describing, I don't know how many people can do this, but this is like you being like a dead body and, just that's the posture, right? I see it that particular way, but I don't know how many people can fall asleep this way. Now, from your experience, tell me, what's the most common pattern you see in which people can fall asleep? And what is the recommended pillow for each type? Because I think the pillow would change if you're a straight sleeper, if you're a side sleeper, and if you're a back sleeper, do you even require a pillow? I don't know. Go deeper on this, please.
Okay, fine. So basically, you are talking about even my own brother, when he was young, okay, he was sleeping like this.
Yeah.
As you told, okay. So when you young, I told you like your disc aging starting after 20 to 25. So when your car under the warranty, okay, whether you buy Mercedes, BMW, there is no much problem. But even after 5 years, it starts to have showing the problem. So if you lying down that way, for young age teenager, there will be no much problem and it is most comfortable position, I agree. But when you turn to 25, 30, 35, you need proper position. And what is the proper position? Short and simple answer. You need to see when you wake up and you have to judge. When you wake up, you feel stiff. Your height of the pillow, it's not correct. Okay. Or might be this is not right pillow for you because there is a lot of marketing is going on for the pillow. This is like cervical pillow, not really required. Just buy a pillow, whatever the rate, like normal pillow from anywhere. And if you sleep on that one, when you wake up in the morning, if you don't have a stiffness or you're not feeling any ache in the neck, that is the ideal pillow. Okay. And if you want me to go deeper into that one, ideally, whenever you keep the pillow, the curvature of your neck should be like this way. That should be the ideal height. So it depends on the height of the person and the body of the person. Like suppose some people are too much tall and their curvature is a little bit more. So they require a little bit more curved pillow or more heighted pillow.
Got it.
Okay. And some people, you see, some people have this kind of neck nowadays. So they require, because they use two pillows, which is not required. Okay. And they messed up with the spine, and that is why they.
So when you see some people have this hunch over here, you're telling me that's because they're using two pillows. You find two pillows in all hotels. You go into any hotel, you see that the way they have made the bed, especially the 4-star, 5-star, 3-star hotels, you would see two pillows over there, and they have really fat pillows. I think that is causing harm in some particular way, right? It's not recommended as per what you're saying.
Ideally, that pillow one is okay, but
two is an
two
issue.
is not at all okay. Okay, that is a way to put it. So I told you, like when you're lying down and your neck in comfortable position, it should be not in like this. So if pillow is more, your head will be in this position. So there is extra pressure. If you put that way also, there is extra pressure on the joints.
Got it.
So alignment normal, simple way, just buy the pillow. See if you're comfortable next morning, it's good pillow.
Got it. And okay, now let's move to side sleepers. Side sleepers, I think they will require a bit more thicker pillow than the thing because there is more distance between my head and the pillow, right? If I'm sleeping this particular way, whereas the distance, like you mentioned, between the back of the neck to the pillow, and if I'm sleeping straight, it's less. Talk to me about side sleepers, please.
So again, remember the rule. What is the rule? Your alignment should be in a neutral position, right? Same way. So when you're lying down straight, okay, your height should be a little bit less. And when you're lying down way, why? Because you also have to cover the width of your shoulder. So that time you can use the two pillows.
When you're this way, two pillows
Okay.
make sense.
So I'll explain you. Suppose I'm straight like this way. Either I sleep straight or either I sleep straight line. My neck should be in this alignment. So ideally, if I sleep straight way, I need, as per my body, might be one pillow is enough that I'm using. And if I'm sleeping sideways, ideally I need to little bit increase. One thin pillow I have to add as per my condition. But some people, they have a little bit more larger body. They can use two pillows. So in the sideways, same way, that alignment should be not like this way or not like this way. So if you suppose I'm lying down to this side, and if I'm using two pillows, extra pillow, more height, so my neck always go in this position.
Constantly bending my neck
Yes.
like this for the
And the
rest of
less pillow, it bends like this way. So in this one, what is interestingly happening, so as I tell you, this nerves which is coming out, when you bend forward, or sorry, sideways, the hole from where it is coming out, they're going to jam or they're going to shrink. So that is why the person is going to have some kind of numbness in the hand when they wake up.
Interesting. When I started going to the doctor, right, I would tell that, hey, I'm having neck pain. Okay. And they would always ask me this question: are you feeling a tingling sensation? Are you having numbness in the hand? Why are doctors asking me about my hand when I'm going to them for the neck pain? And I think that particular thing just answers it, right? Because the nerves, like you mentioned, is there some connection between that to the hand?
I'm coming to the point. So this is the normal people. They don't have a pathology. Okay. To address that answer, I have to go back to the disc. Okay. So whenever you have a pathology in the disc or something, so that liquid in the central part, which is started to come out. Okay. So when it's coming out, okay, if you can see in the diagram, there is some kind of yellow structure you will see. Okay. It's here. This is yellow structure is there. So when disc is coming out, just beside to that part, there is these nerves are there. And these nerves are electrical wires, which is coming out from your neck and supplying your hands. Same work in the back, they are coming out and they are going in the legs. So when disc is coming out, they're going to put a little bit pressure on these fine nerves, which is coming here. And these nerves are elastical bands, okay, and they are working like electrical wires in the body. So you know the electrical wires, when there is a any stimulation or disturbances, wherever it's travel, there is a disturbance. So same way, when disc is coming out and it's compressing, like little bit more compression is happening, you feel some kind of numbness. And that also happens in the stages. If the disc is coming minorly out, you don't have it. When it's coming more out, you have pain till here, sometimes till here, and sometimes also fingers. And this disc, which is coming out also, this is coming out in the 4 stages. So in which stage you are depends on that you have a numbness in the hand. But all the people with the neck pain, if it's a minor, you don't have this one. And interestingly, I want to also say, suppose anyone is suffering with a neck pain, if they have pain only in this region, okay, it's okay, it can be easily manageable. But if you feel your pain is going down and you feel numbness, radiation, and some kind of pulling, don't avoid it. This is a sign your neck disc is becoming more problematic and you need to see doctor as soon as possible. Doctor, physiotherapist, chiropractor. So this is the alert kind, you need to be alert about it. And this is why the doctor, just to address your question, they are keep on asking, you have this one, you have like hand numbness or something, to answer your question.
Yeah, they've always asked me this. And one thing that's also I want to understand is, like, whenever I've gone for neck pain, right? Doctors would sometimes ask me to do an X-ray, and sometimes doctors have even asked me to do MRI. X-rays, MRIs, what are they revealing about the neck pain? If someone has neck pain, does an X-ray reveal it? If yes, what? And what does an MRI come in? Is it actually, because MRI is more expensive than an X-ray? Talk to us about this, doctor.
Okay. So just to give a clear idea about it, so first let's take it X-ray first. What is showing in the X-ray? So X-ray is mainly meant to see your bony structure which are hard. Okay, just to simplify it, in medical language we can see the hard structure or calcified structure.
Basically, if I have to point, the white structure.
So white structure here.
Yeah.
So okay, so disc will never see directly in the X-ray
because it's not a bone structure.
Yes.
Yeah.
Okay, so suppose 50 years of the age person we are taking. Okay, so if X-ray is in sideline, they see the bone, they see all the structure, and they're going to see the space between these bodies. This is vertebral bodies. They're going to see the how much space they have. And also when the disc aging is happening, the space between two, that one is decreased, relevant to the upper one and the down one. And this is how doctor is judging, oh, you have a disc pain.
From X-rays,
From
they
the
may
X-ray,
they may see that the
that this
distance has
space,
reduced.
yes.
Reduced. Okay.
At the same time, the edges of that particular body of the disc, okay, it is not clear. There is little bit disturbance or little bit like, no, you see shaky movements, or the shaky feeling is there. So as the experienced doctor, they can judge. But ultimately, to clearly see the disc, the X-ray is not enough if you have severe problem. So, and the third thing, what they are observing, this is the facet joints, as I told you, the backside joints. So they are going to observe how much space is there. And when the aging process is more, there is some kind of the formation of the extra bone. This is called as the osteophytes.
Extra bone form.
Extra bone, it's the part of the bone. But when you have like a lot of pathology, okay, suppose you have 5 years of neck pain or something, so there is this bone, they try to shrink a little bit and some part it's coming a little bit out like that, okay, that is called as the osteophytes. So if person in the X-ray, they see the osteophytes are there, your space is decreased, so definitely this kind of people have a more serious problem, and this is what we reveal in X-ray. But if the younger person is there, mostly in the X-ray we see everything is clear, but still nowadays person are telling, no, there is a problem from that is out of the experience. Doctor can judge, like, no, he has some like curvature changes. So mostly in the X-ray there is one line written, there is a spasm. So muscular spasm, what happened to neck curvature, it becomes a little bit straighter.
Okay.
So that is a sign that your muscle is working extra and your alignment of your neck is different. So that is how what we are judging X-ray.
Got it.
Okay. Now let's talk about the MRI. MRI is more deeper, revealing about your neck or any structure. So ideally MRI is meant for to see the soft tissue. X-ray is meant for a hard tissue like a bone structure. But MRI is meant to see the soft tissue. So disc is a soft tissue. The muscle, so many structures are there, ligaments are there, so many stuffs are there. To see, we require MRI. And even how much disc is coming out, okay, as I mentioned you, that liquid is coming out. To see exactly, we require MRI.
All that is exactly visible on an MRI. How much
it's coming
degeneration
out.
is happening.
So
how
that
much...
is it. Yeah. So how much is coming, like suppose, let's take the transverse view, the liquid, how much is coming out and how much compressing your nerve. We can exactly see in the MRI.
And that's what, so basically you're telling me anyone comes with a neck issue and has something to do with disc, doctors or physiotherapists always recommend an MRI to judge the level. But MRI, not everyone can afford it, right? It's expensive in India, it's expensive in UAE also. Unless if you have insurance, great. But if you don't have insurance, you're paying a lot of money for getting an MRI. In your experience, doctor, yourself, right? Like when patients come to you, at what stage do you recommend them for an MRI in your experience?
So first of all, no, my 50% of the client, I'm never recommending to go for MRI and X-ray. Okay, that is a bold statement. Again, I want to give you, but the fact is that in terms of physical therapy, assessment or examination, who's trained physiotherapist, okay, they learn how to physically examine the condition. Okay, so with MRI or X-ray, there is always written last line, very small letters. Please correlate clinically. That normally no people read about it, only doctors know about it. So what does it mean? So suppose any patient is there, they have MRI, so much of problem, but that patient comes to me in the clinic, there is no symptoms. This also happens. So we see he's having problem, we will do surgery or we do physiotherapy. No, he's not having symptoms, so we're not going to treat him.
But he's having problem. How do you mean he has problem but no symptoms? How does that work?
I'll go in deeper to that one. So there is research is happening. So after usually age of 50 or 60, if you take any person's MRI, okay, so there is always disc is showing some problem. Any person. Okay.
So 50, 60 is the age where you will have disc issues.
Yes.
You will. Okay.
So if you go MRI, the doctor will tell you, no, your disc is having problem. Come on, this is possible, the aging process also. And why it's happening? Because if you go to our previous conversation, what I told you, the disc aging started at 23, 25. So there is bound to happen some kind of a degenerative changes. So that doesn't mean that you have a problem. But how we judge and how we recommend that whether you require MRI or no. So if clinically, if I see some patient, if I'll check and I doubt about my physical question, examination. I'm not pretty sure. Like suppose I touch the vertebra and I feel there is some kind of a doubt. In that case, even after treating the patient, they are not showing up some kind of improvement. They are showing the symptoms are same or might be increasing. So in that case, I usually recommend them immediately take with the X-ray or MRI. So ideally, if the good physiotherapists are there, mostly they check and the symptoms are not there. Ultimately, you don't require to go for. Ultimately, if you go also, there is some problem. We're going to treat, right? Okay, and if the recovery is coming, there is not really requirement. With due respect, it is required in some cases. I'm not telling it's not required, but almost 50%,
in 50% cases, it's not required.
not required. Why? Because the doctor is going to now psychology of people also like that. I see patients. I give you the example. One person has come to me, so he's sending me the reports. He's sending me so many stuff. Okay, and he's telling, no, I have done 6 months back. Doctor, I came. Do you think I need to do another MRI, X-ray, or something? And I go, chill down. Let me take my examination. So I've taken the examination, and he's telling, doctor, there is some problem. Don't you think before we start physiotherapy, there is a requirement of MRI or X-ray? So his psychology is like that. So this kind of patient, okay, better you go and come.
These patients genuinely believe that an MRI will show
Because that is kind of the marketing. So wherever you go, if you go for a neck pain, doctor will directly suggest go for X-ray.
correct.
You understand? But people are not right understanding. If you go to good physiotherapist, they can check you and your symptom is under control. You start a physio. If you recover, there is not much requirement. So why want to expose your body to radiation unnecessarily? And if you do a lot of MRI, X-ray, some cases because of over radiation, X-ray rays, that can also cause some cancer or something.
Because every time you do an X-ray, there is some amount
So
of
that is
radiation.
why I don't recommend it unless and until I'm in the doubt the person is not getting recovered properly. Okay. So ultimately I have MRI, old MRI or something 6 months back. MRI is more than enough for me. It's more than 2 years, 3 years is not relevant.
2 to 3 years, that's when the data is gone because your spinal structure could have changed in
So
that
just to
particular.
simplify, when is required, my patient 50%, I'm not recommending. If their symptom is with the physiotherapist improvement is there is no requirement. Even by touching now, like my hands, when I touch the tissue, I know there is problem or no, how much. Okay, so experienced physiotherapist can judge with that one. Okay, and if after treating the patient, if you not feeling improvement, in that case, for sure, without MRA, we should not treat them or without X-ray.
Now I want to go a bit level deeper. You said that X-ray can only reveal the bony structures, right? And it can show the distance between each of the discs. Okay, so that's a way people use MRI. It shows more soft tissue in terms of disc, in terms of the connecting muscles or the facet joints, like you mentioned. These are more visible on the MRI. Correct me if I'm wrong. So when I've come to you for treatment, right? And many times when I've even gone for treatment in the past, I've always wondered, I'm going for neck pain, but they're trying to strengthen my muscles. What is the correlation over here? Because, for example, I have a disc bulge. Why are doctors and physiotherapists trying to strengthen my muscles for my bone? What is a muscle bone connection that's happening?
Let's take a deeper dive into that about your human body. Okay, let's take example of any building. Okay, so so building first, what we do, we just structure it with the steel, then we put it cemented pillars and everything. So in the body, same way, this pillars is your bones. Okay, whatever bones you see, that is your main structure. Okay, let's example Burj Khalifa. So Burj Khalifa first they build up the base, steel base, then they put it with the cements or something. I don't know. I'm not an engineer. I'm just assuming. Okay, so and surrounding, we done so many walls and everything. Now when the building structure main is ready, so same way in your human body, these muscles are basically built up structure surrounding that particular bones. Okay, so whenever you are doing any sort of movements, example the neck movements, okay, your hand movement, so this movement is happening with the help of the muscles. So ideally, the muscle has to do the movements. And if your muscle is stronger, now let's take an example for your neck. If your muscle is stronger, so extra weight will not go in your disc, and the degeneration of the disc, the process will be very, very slow. Let's take it in another perspective. Suppose I have to bear the weight of 50 kg, example. Okay, and I'm lifting with that one with the weaker muscle in the neck. Suppose you are doing some gym or activity, and if you have a strong muscle, so weight is going in the disc might be 100 kgs because it's going to accelerate the load here. But if your muscle is strong, mostly disc is bearing hardly 25 kg, 30 kg, and the extra weight is been taken from the muscle.
Got it. So this is the connection.
So ultimately, if you not strengthen the muscle, if you do good physiotherapy, but at the last, if you're not doing the strengthening surrounding this area, your posture is not corrected. So again, the disc is more prone for a re-injury.
Makes sense.
So we need to correct the posture. Some muscle are tighter, we have to stretch. Some muscle are weaker, we have to make strengthening. So that way, again, your curvature in a neutral, and you will not have a recurrent attack of neck pain or something. So that is why it's important.
So you're treating the muscles which are connecting to the neck
Surrounding area.
area,
Yes.
right? Okay, got it. In your treatment with me, this is something that you have used widely. This is your favorite weapon, isn't it, doctor?
Yes. Not favorite, but yeah, it's required in your.
You know, I'm just opening it for the first time. This needle here, okay? Now you have inserted this needle in my body, I don't know how many times. You know, you're just like gone on, and I get pain at times, you know. And I've noticed that you injecting this needle in my neck is improving my neck. How does this needle fix my neck?
Let's start from pathology first, then I'm coming to the point of this one. Suppose this stick, if you are not using, okay, for 1 year, 2 year, 5 years, what happens? It's going to be stagnant. There is some kind of some problem will happen to this stick.
Mainly you can look at cars, right? Like cars also, like we drive every day,
Yeah.
and if I leave my car for like 3 months, 4 months, 5 months and don't drive it, it will have issues.
Correct.
for that, yeah.
So in medical language, if any tissue, suppose this mic, if you're not using for 10 years, is start with oxidations process and it start to degrade. Okay. Same way, when there is a pathology in the neck, so what happens? You're trying to treat that pathology. But if you're not treating for 1 year properly, 2 years, you still have a little pain, as you mentioned, like 10 years, 13 years. So surrounding muscles is also not functioning at 100% optimal level. Let's example, there are 100 million fibers in one muscle. Let's take it 100 to make it more simplified. So out of 100, when your neck is having some pathology, you avoid some movements because of a pain. Okay, so particularly who's responsible to do that movement, that particular muscular fibers, they are not working since last 13 years, right? So out of 100 fibers, 30 fibers, example, they are not functioning since long time. And
Means from the time the injury started.
yes. So what happens? So inside the muscle also some aging process happen and some degradation happen. Okay, and your muscles become like this one. It's called as a trigger points. So that is the aging process of the muscle. As I told you about the disc, now I'm talking about the muscles. Okay, so hence this muscles and the disc go hands in hands. Why? You have pathology, you have surrounding muscle. So this surrounding muscle also started to degrade. Now whatever treatment I'm doing from externally, ultimately your body has to heal from inside. Now interesting fact about this trigger point, these are the dead points. Okay, dead points means
They're no longer active in your body.
yeah, so they are not actively participate in the metabolic activity of that area.
And even in the movement of the area. That's
So example, suppose I'm giving hot packs or I'm giving ultrasound, whatever the treatment you are doing externally, but these areas are not getting recovered. So unless and until these areas also not open, they are not functioning, you feel some sort of pain, okay, to your subconscious mind. So to open up that areas which is since long time not activated in muscles, that naturally happens hundreds of areas when your muscle is not working. So that area to open up, we use this weapons called as a dry needle in physiotherapy. So when exactly in the angle or particular things I'm hitting that areas, you feel some kind of prick.
yes.
Okay, so when I'm out of millions fiber, this you can see very tiny needle. It hardly touches hundreds of fibers. So exactly with precision, I have to particularly touch that area where there is a blockage or trigger points. So when I'm touching with the needle, it's open up with some jerks.
Correct. I get a twitch. My body twitches and that hurts while that happens.
So what happened? Like you are not eating since long time, and suddenly there is a food comes to you. What happened to you? So that way, if needle is sitting that area, there is a sudden opening of that area happens.
Got it. So you're reactivating those muscles which have stopped working for a long period of time.
So mostly in physiotherapy, out of 10 cases we treat, almost 6 to 7 they recover, but 3 to 5 or something they are not recover because there are so many trigger points in surrounding muscle because of long term pathology. So this needle is very essential to release that particular fibers, and that is how you feel your body is giving signals. Now it's this area is functioning well, so it stops giving feedback to your brain that there is no pain.
It's a very fine needle, right? If it's visible over here, it goes in and as you said, it's impacting hundreds of muscle fibers. Now, my neck, around this, there's so many. I think there are 100,000, 200,000 muscle fibers. Right? How are you identifying what point I need to insert this needle in for my issue? How does that happen?
So that is now in physiotherapy. There is a special technique. It's called as a dry needle. And as a physiotherapist, we are trained for that one. How to identify which muscle usually happens and how to do that one. We are actually trained for that. So I also trained for that. So world's best teacher, okay, in the dry needle. He's actually right now he's researching in the dry needle. So I have the privilege to work with him, to learn from him. And that is how we learn this one techniques. And it takes almost around, as per his like no telling, you require 10,000 pricks to get that idea where exactly that point is there.
Wow.
So he is telling me that way when we learn. So then I realizing starting you're not able to precise, but as you're more precise, you are more experienced, exactly you can identify with one prick only you are hitting that right area.
And I think even for the experience, right? Because when you deal with these kind of patients on the regular thing, you know that where are the portions where common trigger points occur. So if someone comes to you with a neck pain, you're like, okay, this portion for sure is a trigger point. And once you insert the needle in, your hypothesis is further validated by the twitch. And I think if you get that twitch which comes, you again try going deeper into that area to get more twitches. Okay, this has been one of the most effective therapies that you've done. This needle doctor has caused a lot of relief for me in my life. And earlier I used to complain, but now when I go to your facilities, I'm like, insert this because this particular needle has brought relief. There are other things also which you do, like in terms of treatments. I've seen you also do, for example, for me personally, you have done dry cupping. I think you have used those cups, and then after that I have these red marks all over my body. You have also done IFT. Is IFT. So these are different treatments that you're using. How do you evaluate what treatment is the right? Because you're giving me like 4-5 treatments right now, right? Like when I come to you for every session, in one session, right? You're giving me 4-5 treatments. Why so many different treatments? And you're probably also the only one. When IFT is happening, you're also putting a hot pack or something. I don't see other physiotherapists do this. What is with the concoction of treatments together? Why can I not just get one? Why am I getting so many over here?
So basically, as I told you, whenever some problem happening to any tissue, so suppose disc is injured, so surrounding also some muscle get some weakness, some tightening, and some kind of other tissue which is surrounding that tissue also affecting. So address everything, okay, all together. We need to use different modalities. Each modalities have some different kind of purpose. Okay, so like suppose you are cooking, so you add some like chili powder, turmeric powder in Indian spices I'm talking, but some Arabic spices use different. So that way, in terms of physiotherapy, if you go physiotherapist, so as a physiotherapist, we train to have different techniques, and that different techniques has a different purpose. So we analyze the patient as per the patient's requirement and the result what we required, accordingly we use that one. So that hot pack and this IFT which you mentioned, so in the books, none of the books giving that idea. That is out of my experience I developed that one, because I see this when you put this one together, the effect is almost double. So why I want to waste time of my patients? So I
Give them
designed that.
relief faster.
Yes, give them release faster. Okay, so these are some of the techniques out of my experience. Okay, I just developed, and that is why we are using as per the requirement. And the cupping also we are using sometimes. In physiotherapy, people are not aware about. There are so many techniques are there. I just named it a few. First is called as electrotherapy, which is machine therapy. Some kind of machines they are putting vibrations, ultrasound, then some kind of muscle stimulation. That's all comes in the electrotherapy, one part. Okay, this hot pack, cold pack. Then there is come as a therapeutic exercise. So in the stretching, strengthening, flexibility exercises, there are so many exercises. Okay, it's divided in that pattern. Then some specialized technique. One of them is dry needle. Then we know the coloring band. Some of the sports player they have on the shoulder, like especially in the ballers. If you go in cricket, footballer they have in the legs. That is the technique is called as a kinesiotaping. Another thing, cupping. What you already experienced. Okay, that we are putting some kind of cupping. Then we have some other techniques that manual therapy. Okay, so manual therapy basically on so many joints. So some
You have given me that as well, right?
yes.
Yeah.
Okay. Then in manual therapy also there are so many. Okay, we'll not go in deeper, but I'm specialist for the Mulligan. There is McKenzie concepts. There is other concepts. So manual therapy is also there. Then some special techniques are there. It is called as a MET. MET is muscle energy technique. Some neurodynamics, especially this techniques when you have this nerve pain. When you go to the doctor will advise you to go for injections or might be go for a surgery because there is no way they can treat or release the nerve. But in neurodynamics, neuro means nerve, dynamics means we are moving that nerve freely from all the angles to release it. So these techniques, very few physiotherapists are trained. I cannot say all are trained, but mostly in my observation, okay, hardly out of 10, 2 or 3% I see that to do. So that can really help someone knows about neurodynamics. So these are the so many weapons as per the requirement we use. Like in kitchen, we have different like no. So you are cooking some biryani, so you use the normal one. If you are cooking some kind of
Making
omelette,
a pizza, it's a completely different
so
weapon.
it depends on that. So we are also playing with that one as per the requirement of the patient.
Perfect. Okay. And now something which you told earlier was, and this is something I want you to clarify this. Sometimes people get hurt. Imagine I just fell down and it's hurting. Right? I probably fell on my bone. Some people are saying that put ice on it. Some people are saying put a hot pack on it. Okay. I want you to clarify that what should be put? When should we use ice? When should a hot pack be used for someone? And for someone like even go deeper to this is immediate. And someone even for chronic pain, right? Tell me when should what be used?
This is again very burning question. All that always I'm getting. Okay, so in that one, just to simplify, okay, when to use hot and cold. As a physiotherapist, we learn a lot detail about it, but simplify for normal person. Whenever you have acute injury, suppose you are playing a sports, you got injury, apply ice.
Acute means short term. I immediately got it.
2-3 days only you got injury, okay, or might be 3-4 days you got injury immediately. If you see any sports player, any physio is coming on the field, mostly they come with ice packs.
Correct. I see it in IPL right now, right? In injuries people get, okay. And what does that ice pack do at that particular point of time?
So ice pack is basically designed to drastically desensitize your nerve which is causing the pain. At the same time it also drastically reduce like a swelling in that localized region. So it's working like a localized painkillers without painkillers. Okay, so whenever you have a too much swelling acute and you need to like decrease the pain, okay, apply the ice. Example wise, you have muscle injury, ligament injury, or acute injury, you can apply the ice. Right now, coming to the point, like suppose you have a chronic injuries, like you have suffering from 1 month, 2 months, 6 months, or might be years. You have a joint issues or something. So hot is more relevant because whenever you have problems since long time, the metabolism in that area is stagnant. Okay, so whenever you apply the hot, the blood flow in that area will increase. So just to activate the healing process of stagnant area, okay, like we are just waking up that is hello, get up, you need to heal. Okay, so that's why we are putting that hot.
Okay.
Okay, but there are so many deeper perspective, but just to simplify it, whenever you have acute injury, cold is better. When you have old joint injury or old pain, better you apply the hot.
And I see sometimes people are doing both. They're alternating between hot and cold. Why do they do that?
So that is called as a combined therapy. So when particularly cold and hot is not working, and that is especially happen with the old injuries, so we are using combined therapy. So combined therapy, what exactly done, when you apply the hot, okay, it gives the blood supply suddenly, and when you apply the cold, it just decrease the blood supply. So what happened, there is a wave kind of happening. Okay, so something not like segment or straight. So if you keep doing that way, some kind of old injury, they heal in a more better way.
So are you telling me that for chronic injuries, hot therapy and hot and cold therapy is very, very effective?
Very effective.
And which is more, hot or hot and cold? Which you have seen in your experiences?
Ideally, like hot is more better if you go straight forward, not to make it complex. But some people they like to do hot and cold. Ideally, it's not functional or logically to do, because how you can apply hot and cold, it's quite difficult. So if I tell you, if some people they are having a old injury, better just go with the hot, is more easier. If it is not working, your physiotherapist or your doctor will suggest whether you require this one or no, but don't try directly from your side.
Now, doctor, there are multiple ways. I want to go again a level deeper on this, right? There are multiple ways in which I could do this, right? For example, if I have an injury, I can be very localized about it by just applying hot or cold in that particular space. Or I could go all in and go for an ice bath. When I go for an ice bath, I'm immersing my entire body in ice, right? So I'm not just immersing that particular region, but the entire thing. What is a better approach to take over here for someone who's having an immediate injury? Do they go for an ice bath or localize, and what are the benefits of each?
So when you're talking about ice bath, or suppose you go for jacuzzi or hot bath, that is not working locally. That is working your whole metabolism system. So nowadays you tell no cold bath challenge. Why it is there? Because when you're taking the cold bath, basically, so your overall blood, like blood temperature in the whole body, okay, is trying to shrink. At the same time, when you're coming out, there is pump flow started. So that will give kind of no refresh button to your body. Okay, if you see Anthony Robbins, or recently I've seen this Vishen Lakhani, he talked a lot about like ice bath challenge about it. So you immerse your body in the cold, so it's kind of like switching on all your reflexes and body. Okay, if you're going in that one, your body's, what are the areas are talking, some of the like areas we are stagnant, they also can be activated with this one. But that is immersion. Okay, what I talked lastly, that is about localized. Yeah,
Because you apply locally, and this is like
this is different
which,
approach.
which is more effective, like doing cold baths effectively. Like, can I do a cold bath every day, or that's not the right way to go in your
Okay,
experience?
that is depends on your conveniency. Suppose if you enjoy that one, if you do also daily, that is no harm. But ideally, daily ice bath is not recommended. But once in a while, like once in a week, ice. I'm talking about the ice, not cold bath. Cold means normal cold water, tap water. That's okay. But cold bath, ideally, it's 2 times in a week. Maximum is more than enough. If you take it more, also there is so many metabolism changes will happen. Okay, when that better you go to any trained person who knows about it and take that advice and then do it. Some athletes they are using for some performance reason, but normal person once in a week is more ideal. Okay, don't do more than that, otherwise so many different not changes happens to your body as well.
I also want to discuss something about, since you mentioned about athletes, right? Athletes and stuff. I see them doing so many things. And yes, they're putting their body through so much physically. They are constantly in the field training, practicing, and then performing on the match day, or it will be it in the field of football or in the field of cricket, right? They're always practicing. If they don't practice, they won't get good on the field. And they always, I see them doing ice baths. I see them doing something along, what is that place where you go in and it's very hot? Like, what is it called? Steam?
Steam.
Yeah, I see them doing steam. And I also see them
Sauna.
doing sauna and multiple other things. I also see them getting something called a deep tissue massage. What is a deep tissue massage exactly, like, versus an ordinary massage? If you can clarify that out.
So ideally nowadays people are not active. Okay, I'm not talking about athletes, normal people. Okay, for athletes little bit different scenario. I come to the normal person and then athletes. So suppose like normal person, they are not moving all the muscles. There are almost around 612 muscles in the body. 612 muscle. You're not moving daily all the muscles, correct? So sometimes if you do the massage for your full body, that is good for your muscles to activate and then normalize the blood flow of that muscle. So normal massage is a good. Now, whenever you go for a deep tissue massage, what it means? Deep tissue massage means mostly in the athlete, they need to have their each single fibers working when they are in the field. Okay, so when they do deep tissue massage, that gives a lot of relief to that muscles which is working really, really hard. So that is why the deep tissue massage is essential for them. But ideally, every 3 months, the every person should also go for normal massage
Every 3 months.
every 3 months. It's really good to make your body refresh.
Doctor, you know something? I have not got a massage in my life. I'm 30 years old and I have not gotten a massage at all. So you're telling me I should just get one every three? I've never got it done, ever.
For that one, I also make it scenario. If you're active physically, like you're going a gym, right? It's not required. But if you are inactive, if you are not going even gym or something, the people, they are elderly, 50, 60, their muscle is totally like no stagnant. They are not moving their body, joints are stagnant. So for them, it's working good to activate that muscle. But normally, just to prevent from you, like you are 30, right? So you can start now. So it will also going to give your muscle good health.
Deep tissue does not apply to me.
Sometimes okay, but not regularly.
Not regularly.
Yes.
Once in a few months, maybe.
Yes, ideally.
So we discussed about deep tissue massage now, okay? Something else I keep seeing on the internet right now is chiropractors or other doctors, or even sometimes I see normal people cracking their necks. You know, they take someone's head and they do this, and that scares me. When I see that, that's a very scary thing, because I've seen two things happen with this way. One, I've seen someone feel better, and in movies, I've also seen people dying this way. If you do this, I've seen someone being killed, and that's scary. Talk to me about what's happening, and does it actually make your neck better, and how can it be done in a way that people don't die?
So basically, this neck cracking nowadays, like no, that is a lot of hype relevant to that one. So when you do the cracking, there is some kind of releases happening. Okay. So why it's happening? Because as I mentioned, okay, in your spine, there are so many facet joints are there. So when you basically not moving your neck for a long time in particular angle, so that kind of that angle of that particular joints of facet is not open up. So when you just hold the neck and passively, like some doctors, chiropractor, some they are doing the osteopath or some physical therapist also they're doing, when they crack, so they are going to open up this locked segment of that facet joint. And this open up with jerk, so it's gives some sound. Okay, so when this happens, so basically you feel your range is open up, and there is a sudden spark or reflex activity happen to your brain. Okay, there is some segment which is not open, it's open, so it's giving some kind of a relieving hormones. Okay, and that's why you feel good. Now another thing in that, add layer to that one, so when the chiropractors are doing, they are cracking each and every segment. So there are surrounding your spine, there are some the nerves are also there, as I mentioned. So when you particularly crack, so the more energy and oxygenation flow will be there to this nerves. And that is how some of the chiropractor or some of the people or physiotherapy, when they do it, they feel a lot of relief in some kind of the metabolism disease. So that is little different you have to understand.
Talk to me about the safety aspect of it, because people don't want to end up with injuries, and in worst case scenario, probably meet my cat. She's just joined our podcast right now. See, I even see cracking happen in the case of animals, right? Nowadays, there are doctors which are
Yeah,
cracking
I recently
animals, and you see a different reaction. So, talk to me about the safety of that side.
So basically the cracking or this manual therapy osteopathic cracking, it needs to be done with only and only with certified person who knows about it. That's the first thing. You should not do by your side or your own. And I've seen especially the barbers nowadays also there is a craze. Okay, they see that in the video, they go to some barber shop, and nowadays barber also doing. So it's not at all safe because they don't know what is anatomy, and they in the wrong angle they pull you. There is a chances you got muscular pull, that is called a muscle spasm. And if it is even more force, sometimes there is a risk of the compression of the nerve or some kind of hairline fracture or something. Ideally it's so much of hype, okay, about that one. But genuinely if you move regularly, these whole things you may not require.
If you just have proper movement.
But people, they need something fascinating, they need something interesting. So that is why oh wow, you see that reaction. Okay, so that is why people are getting crazy about it, and there is so much of marketing like budget is involved with that one. So that's why people are more prone to that one.
I want to deep dive into this myth, right? As a kid, I used to crack my bones, the safe areas, right? I used to crack my, you can see, like I'm doing it right now. And when I used to do this, my parents would be like, don't do this, you're harming your joints. Why do people say that? Some people say it's okay, some people say that's actually harmful for your joints. What is the actual case over here? when it comes to cracking, and how often can you do this? So going a bit deeper, like yes, you can do it. You said it releases, but how often should you be doing it, and is it safe? Why do people make that statement?
It is also subjective. Genuinely, there is no scientific proven materials as of now I found about it. But if you're cracking on your own regularly once in a day, like suppose I cracking, that's okay.
That's okay.
But ideally you should not do too much frequently, because what happen, no, when you're cracking, ideally just try to understand that one, there is two joint surfaces are there. So when you're cracking, there is suddenly friction also happening between two joint surfaces. So between the two joints there is a smooth material called as a cartilage. So when you do lot of cracks, so this cartilage is very smooth surface, like no, on the cadaver, when we studied our medical school, we need to see the dead bodies, we need to touch each and every tissue. Okay, so when you touch that any dead body's cartilage of any joint, it's very smooth. If I put the fingers, it slides that much smooth. So when you do that again and again in early stage, like no landed with the arthritic changes or something like that, but that is also very rare. But ideally once in a day it's okay if you feel comfortable. So that is the scenario. So you should not do.
Hand cracking once a day. What about neck cracking?
That is also once in a day if
You
are doing
can?
actively.
Oh
Like,
wow.
so
Okay.
suppose I have some patient, no, they're cracking. I'm crazy. You don't have to even come here. You do at home. But if you are cracking and you are just doing for one some relief, it's okay. But some people have the habit. So that is not right, because no, you are unnecessarily straining your body for more injuries.
Interesting. And I want to. We have discussed about athletes and stuff. Now I want to talk about the regular person. Okay, I want to go about the regular person who has a 9 to 5 job. Okay, 9 to 5 job, 9 to 6 job. Even me as an entrepreneur, I'm always in front of my PC. PC has become one thing that you are always next to, right? So I really want the people who are watching this podcast to work better. Whether they're working in an office, whether they're working remotely, or even if they're working in a cafe. Tell me, doctor, what are the best work setup that someone can design their life with so that they don't face neck issues while they're working in home, office, or any other cafe where they're working from?
So this question is very relevant nowadays, because 80% job is white collar jobs. Mostly we are in front of the desk. So ideally, whenever you're working, there are 3 to 4 things you have to remember. First thing we already covered up. So whenever you're working continuously, okay, you need to take at least every 1 hour a break. The simple solution for that one, like no, you just take your neck back and just rotate left and right. That is also, some people are even lazy to do that one. So what I will tell them, you just keep your water bottle 2 meters away from you. Simple solution. So there's water bottle is visible. So we'll remember to drink a water, but it's 2 meter away. So for that one, what you will do, you just go, get up and come back. So that is a relevant solution. Okay, that.
And you'll also fulfill your water intake of the day.
And your screen, whenever you are working, ideally your hand supposed to be relaxed in that manner.
Okay.
Okay, like it's not supposed too much height at the shoulder level, but the angle, this angle, okay, you can see how it is. This is ideal, I'm stable, and then I'm supposed to do it. But sometimes the desktop is too much heighted, sometimes too much low. Okay, that is adding extra, like no pressure on the muscles and the joints. That is not ideal. Your screen, whenever you see your screen, there is a 90 degree. That's just, you have to put it 10 degree, a little bit more, 15 degrees from that angle. So almost around 105 degree angle should.
For the screen. The
Okay.
laptop which is bent.
Yes.
Okay. Don't bend your laptop. Don't keep your laptop 90 degrees.
Not 90 degree. Yeah,
It
this is
should
not ideal.
add
Like this.
another 15 degrees
Yes.
and bend it that way.
Bend it that
for
way.
Proper neck
Proper
posture.
neck posture, and like comfortable to work for a long hours. Okay, and especially when you like working on the desk, or when you sitting long time, okay, you should be not hunch forward. Some people, because their positioning is not right way. So if I close, like suppose I close here, I'm comfortable, my laptop is here or my PC is here, at the same time my hand should be rested ideally. Okay, and maintain the little touch of on my back from the chair. So suppose you are too much forward, you are not touching your backside to your chair. So if you lose the touch, what happens to there, your muscle getting tired, and that is adding the pressure to the disc, and that can cause the problem in the disc. So when you touch little bit also, just one touch is there when you're working like this way, there is a little touch is there. So subconsciously your muscle are not getting tired, body is giving okay, it's rested enough, so extra pressure is not coming. So that way the prevention of lot of serious back or the disc pain you can so just to sum up, we'll just talk about ideally water bottle a little bit away, so 2 meter away. Then three things: when you're sitting, your hand should be rested enough, your forearm should be rested enough, and your angle of the desktop supposed to be a little bit 15 degree down or 10 degrees down, just like this way. And you sit when there is a touch backside of your back.
Got it.
Okay. And in that one, I want to add one layer. Nowadays, people are telling there is a myth here about the neck. They are having some extra support, whether it's
Even this chair we are sitting right now, this is a neck support right here, right? Which is there. And if I have to access it, I have to sit back like this. But that's not very comfortable. I really cannot sit like this and work. This is a much more comfortable posture for me. Talk to me about this.
So about the neck support, ideally, whenever any person is working, they never work like this.
Correct. It's awkward. Like I can't. Like my eyes are, I'll not be able to focus. Even in the car, people have neck support, but to actually drive, I need to come forward. I can't sit in this particular posture and drive.
So the thing is that, like, why I'm talking, because this is the practically I found it. So like no, if you touch your back here, your some of the muscles which is starting from your back is coming till your neck. So automatically the muscle is the one. So if you touch here or here, is the same thing, almost around. I'm not telling all the muscle, but the main muscle which is coming, that erector spine, is there and is giving some conscious message. So if you touch back, it's more than enough.
Perfect.
But logically, if you touch your neck, you're not going to work like this. So nowadays people are no too much marketing is going on about no neck comfort to prevent a neck pain or something. Don't
It doesn't work. It doesn't
work. Just take your video of 8 hours of working when you're sitting. You never work like this. So this is not ideally required. You require is just one. You just move your neck every 1 hour. It's going to solve the problem. How? Because my neck is in front position little bit. When I'm taking like that, there is like no and like no doing the reverse movement. I accumulate the stress, I reverse the movement, automatically stress here and the disc is less.
So it's all marketing that's being fed to us, right?
Unfortunately, yes.
Even
because recently I see this.
I bought chairs like these because of the neck support as well.
Because recently I see one video like that. Okay, and I supposed to call the company and ask them. I told it's okay, but nowadays is going on. People are keep on asking the questions about it. So that's a very interesting fact. You should tell our like the viewers should know about it.
100%. And there's one more. Okay, let's take this one level deeper. Okay, now when you're going to cafes and stuff, yes, you can have your laptop. You can't carry a physical desktop with you, right? But when you are building your home setup, okay, now imagine someone sitting at home. Laptop also, there is some level of bend. We are trying to minimize the neck bend, right? So, and ideally for that, if my hands are this way, a desktop is much better because over here I'm not bending at all, right? A desktop screen which is large enough. Talk to me more specific to a home setup right now, where I can have the desktop or even an office, because nowadays some companies they're giving employees a proper monitor they can use. At what size of monitor they should be looking at, what eye level should it be? You spoke to me about laptop. Now come to about desktop.
So laptop or desktop, the scenario and the rule is the same. Your screen should be at the angle of 15 or your neck angle whenever you are watching. I'll just give you another like way to understand. Suppose I'm sitting like this way. I'm straight watching like this way. Okay. So just 15 degree down. This is my ideal to work with the laptop.
So I should not be having a big screen. For example, if you see my setup over here, this is my work setup over here, right? And this is ideally so eye level. It shouldn't be eye level then?
No, I don't mean to like shouldn't be eye level, but at least the screen should be not exactly 90, little bit like this, tilted. Okay. I'm not telling you should not put in front, but little bit like this.
So even in that thing, you should tilt it slightly.
Tilt it little slightly. Because that is a right angle. It will not giving the strain in your eye muscle and it can prevent a lot of headaches when you're working for a long hours. So especially your eye level is not proper. So because of that, some people getting headache because of the strain in these areas of the eye muscle. There are 6 muscles which is working to move your eyes. So that one of the muscle working harder, that gives the headache. So this is the concept wise. And okay, very interesting fact I want to tell you. Nowadays there is standing desks. So
that's perfect, right?
That is
basically
perfect.
By what you're talking
that
about.
Going to solve the problem. However, you're going to change the position. Like every 1 hour, suppose you're working now and sitting, just work in a standing for half an hour or something. When you're comfortable again sitting. So that is an indirect way exercising to your spine. And there is a liquid is going to again circulate and there is a nutrition is provided properly.
Again, standing desks have different levels of heights. How much height should someone be raising their standing desk? How much? Because it can go up to, what's the right height for a standing desk?
Okay, whenever you're making standing decks, there is a like no difference when you're sitting ideally like this way. But whenever you are standing and doing the work, ideally make a little bit heighter. Okay, little bit down to your shoulder level. Okay, and not at the same level. A little bit down, but not as you are sitting. Okay, there is specific angles, but I go with the your comfort. Okay, because no angle no one remember logically. Basically, like sitting is like that, and when you're standing, it's a little bit heighted.
higher.
It's more comfortable. So you can maintain again that one. If you're putting too much down like this, you have to look it down because it's standing desk. So it's standing little bit like this, so it's going to solve the problem with the angle.
I have a question. When I'm using a standing desk personally, and this is an investment I've made, and my body is touching the standing desk, is that okay, or it should be away?
Little bit fine.
But not, it shouldn't touch when I'm sitting down like this, right? The body should not touch this particular thing. Or
1 inch difference is okay, but supposed to be nearby. So then only you can maintain the touch of the back.
Now, glad we've clarified the different workspaces that people are operating out of, whether it's from home, whether it's from cafes, whether it's from office, whether it's sitting desk, standing desk, whether it's laptop, whether it's a full screen monitor. One thing that I want to go back to, something which you said, is about headaches. And you just mentioned about headaches. Nowadays, there is also correlation between neck pain and headache. And people may not realize this, right? Like, again, just like how people may not realize how important muscles are to your neck pain or to your thing, even these two are related. Talk to me about this relation, and why is this relation there from your experience?
Almost around nowadays in my practice, I see some people coming with a headache issue. So mostly chances are there, like whenever you have a neck pain and you are not resolving, okay, for a long time, especially the people, they are working like this posture. Okay, so you see the posture of the neck is not right, and the upper part here in the neck, they're straining more. Okay, and these people tends to have more headache. Why? We'll go in deeper why is like that way. So here, if you see the spine, there is a C1 and C2 vertebra are there. There is called as atlas and axis, name wise we'll forget, but C1 and C2 is there. And upper side here in the neck, there are so many fibers of muscles, so many muscles are there. So whenever you are having a pain in the neck since long time, when your posture is like that way, so this upper fibers of the muscles, this muscle getting tighter, and they're attached with your neck. So when this muscle is getting tighter, and when this happens, and when you're working that way, the malpositioning of this C1 and C2 vertebrae happens. So malpositioning in our words means it's supposed to be in this manner, but they are a little bit like this, a little bit difference. Yeah. Just to give the example. So when this happens, there is a last part of your brain is coming in this areas.
A portion of your brain connects to the spinal cord, which is the top portion of the spinal cord. Okay.
That's called as a medulla oblongata, but let's forget about the anatomical name. So the last portion, whatever it's here, okay, of the brain, whenever the malpositioning is happening, is going to compress that areas. And you already have this like tight muscles and everything. So all this thing is called as a cervicogenic headache. It's relevant to your neck. And I see this patient mostly when I'm going to release this C1 and C2 in the one session, they got 50% relief. And people are not aware about that, and they're taking so many medications and so many stuffs are there. But in physiotherapy, we have to check that one, whether that malposition is there. We take very detailed history. So all the people might not get relief with the one session, just to give idea. But if it's exactly relevant to that, it's acute. So people are getting, like I can say, 60 to 70% of the people, they're coming with a headache. They got really nice relief. They never feel in since so many years.
People are aware that neck issues can cause headache, because normally if you get a headache, you wouldn't go to a physiotherapist. Like, that's not the first thing that I would think of, right? I would go to a brain doctor. I'll be like, doctor, what's happening in my head? Like, I'm getting this. So how are people coming to you? I want to understand that. How do they associate? Because now I'm finding out, right? But this is still not common knowledge.
So some people, they suffer with a headache. Okay, they are telling them, you are having headache or something. And mostly the history for the neck pain.
They have a history of neck
pain. So this is the way we judge. 80% of the people, they have a headache, which is relevant to neck. they have 1 or 2 years before history of a neck. This is how we judge whether this is relevant or not. So, and some people they're coming with the neck pain and also they have a headache. So there is interrelation. If you ask the history whether they have neck pain or no, we can easily identify is relevant to that or no. And in terms of physiotherapy, there is some specific examination we do. So that is more confirmation technically and medically. So this is how we judge whether the person is suffering from this or not.
Thank you for clarifying that, Dr. Ravi. Now I want to talk also about one other silent aspect of neck pain, which is stress. And this is something that I've been hearing about. I never imagined that stress can have something to do with neck pain, because so far whatever we have been discussing in the podcast has been in terms of wrong posture, in terms of the way sleeping posture, but stress has nothing to do with your posture, but it still causes neck pain. Explain to me, please.
So your human body is driven by the emotion. Always remember, your motion is created by the emotion. Okay, remember this term. Why I'm telling you. Suppose you are excited, so your body is not going to be dull. You're going to be power energetic. So when you're dull, your body is going to be like that. So stress is emotion, right? So whenever you are in some emotion, your physiological also you are in that particular things to your muscles and the body. So in the stress, mostly what is happening, first we'll understand what happens in the stress, and then you coming why it's creating the pain and the neck pain. So when you are under the stress, you are more alert. You are
Your
anxious.
senses are heightened. Right?
Yes. You are most anxious, and mostly these people are they are not getting a night good sleep. Good night sleep is not there. Or might be they are very late night sleeper. They wake up like 3 a.m., 4 a.m. They are go for bed. So this kind of people they tends to have today or tomorrow stress, because you are not working with the normal circadian rhythm of your body. Circadian rhythm for your body. Okay. Now because of the stress, what happens? Ideally, when you are under the stress, you will more alert and your shoulder get tighter. Okay. If you observe clearly, you know I'm relaxed.
Yeah. When you relax, your shoulders are light.
Right.
When
When you
you're in stress, yeah.
stress.
But this is
So-
happening subconsciously.
Yes, that's what I'm telling. No, your emotions creating your motion is attached. Okay, so what happens? Stress, tighten your shoulder, your neck is not relaxed. You'll be a little bit more front. So your posture in the neck is not good. Okay, so continuously like that way for 6 months, 1 year, or 2 years, if you are working, so that can create a lot of disturbance in the alignment of this area. At the same time, some tighten of the muscle, and as you have in yourself, there are a lot of trigger points formation in this muscle that is called trapezius. So that way, now you come into the entry of pathology side of the neck pain.
Perfect. I think we have covered out so many causes of neck pain. Is there something that we are missing out, doctor, that we have not covered in this particular episode so far?
Nowadays, young people they have a problem in the neck. Why is happening? Because young people they are going gym, okay, and they usually have wear and tear injuries. And nowadays I see, there is a craze to become a biceps on like dole shole, all these things, okay.
Have big shoulders, big biceps, have that V-shaped taper in the body. Yeah.
So recently we treated one case. He's very young guy. He got an injury 1 year back in the shoulder, and he's been not treated that one because he's a gym person. No, that mentality, push yourself, push yourself.
Injury is nothing.
Injury is no pain, no gain, like that. Okay, I don't know who like is thinking that way, but just keep on pushing. So what happened? Your neck and your shoulder is interrelated.
They're adjacent.
Yes.
Yeah.
So if you have injury here, okay, you are more to tend giving more pressure on these areas as well. So when you're lifting, okay, this muscle is not anywhere working. Example, you're straining this muscle. Okay, there is overexertion happening in this area that also cause sometimes the neck pain and the neck muscular strain, and the vice versa. Okay, suppose you have a neck pain and this issue, mostly my 50% of the client nowadays are coming with the shoulder injuries and the pain.
Like me, for example.
Like you. Why this happened?
Started off with neck pain, which I came to you, but recently I've injured my shoulder also, and you're treating me together, right? Neck and shoulder both.
So I usually give the example to my patient. Suppose you have a owner of the company. Suppose you have 4 employees. 2 are not working since 1 year, 2 years. So you need output from the company. So what happens? There is a stress happening to the remaining 2. So what happened? Today or tomorrow they're going to tired. The same way, your neck pain is there. You're not treating well, and the extra weight is going on the shoulder. whenever doing, or vice versa. So that time also, that is secondary problem will start to happen. So it's interconnected. Body is really amazing design. I must say the world's best engineer design is the human body. And as a physiotherapist, we consider, I usually say to my fellow junior people or the doctors, we are human body engineers, because we can change the biomechanics and the body's some of the things. Suppose person is having not having a leg, I want to make him to do the marathon. That is work of physiotherapist.
It's amazing what you're talking about, right? And
So that's, I'm proud about that.
oh, 100%. Like you should be, because you're causing an impact. You're making people's lives better. You know, um, when I was reading up about you before we started working together, you have solved 70% cases. Doctor, you have no idea when someone has had pain for 13 years of his life. You know, that I really
I
cannot.
still remember the when we had a first conversation.
I literally came, I told you about everything, and I like the fact that you sat and you were like, you were just listening. You were listening to all the issues. You're like, Neet, take me through each and everything from the start, and I think the first meeting we had was for 1 hour. And I love the fact, right, that you're giving so much time to your patients, because doctors these days, they don't. Physiotherapists, even like, I go to a doctor, they are like, okay, 10 minutes in, they do something and that's it. They let the patient go. But you're actually spending 1.5 hours with each patient, examining the history, seeing all that stuff is what I love working with you, right? And that's why I hope, doctor, I'm currently 70% better. I really want to reach 100%, and I want to do everything I can to make this particular recovery happen. Because for me, they say, right, when you don't have health, that's the only thing that you're aiming for. No amount of money can cure this for me, right? Like, and I have to get better, doctor. I really have to get better. So for people who are watching right now, I don't want them to end up where I am. You know, I really don't want them to be in the pain that I am in for the last few years. What can people do in the gym? Let's start off with in the gym, that they don't experience neck pain. Because what are some early signs? Like, okay, I'm doing an exercise and I notice something, I should stop doing that exercise, because I know. Because in the gym, like you said, they are like, keep pushing yourself, keep pushing. How do you know that you're about to injure your neck in the gym? Let's start with that.
Anything you do in the body, I told you the body is very intelligent engineering structure. So pain is kind of the feedback, it's feedback loop. So anything is wrong happening to your body which is not supposed to be there, you always have a pain, right? And any pain which is persist more than 2 weeks, you should not avoid that pain. Simple as that. So that means something is wrong. You need to correct it. And when you're doing a gym, suppose you are doing the traps, like no, with the wet. Okay, mostly. And nowadays, people are doing with the therabands and something like neck extensor exercise. I see in the wrong way. I feel like no, they are good patient for me in the future. I'm telling in a funny way.
Yeah.
Okay, but the thing is that no, if your body tell you there is a pain for persistent for 2 weeks, don't do that activity. And if you feel with the resting for some days, again you're not getting a pain, you can start. But still, if you have it, you need to see now medical practitioner.
Okay. And when it comes to medical practitioners, also, sometimes this has happened to me multiple times, because I've consulted multiple physiotherapists over here. They just say, stop going to the gym. Their simple answer is like, yeah, you injured yourself in the gym, stop for 2 months. What happens when I stop gym for 2 months? All my progress, which I have made, the muscles I have built, it just goes away, right? How relevant is that advice? Like, is that needed, or it's only needed in few cases? When should that person who's having neck pain stop going to the gym, from your experience?
So the stop going to the gym, it's superficial state. I will tell you, he didn't take the time to understand your emotion about the gym. So ultimately, that doesn't mean you stop going to gym. He mean to say, ideally, you should not do any activity in the gym which hurts your neck and the shoulder. Okay, I'll usually tell my patient, if you have that, some people they like to go gym, so go and do the cardio, or you can do weight less, repetition more mode.
Correct. Reduce the weights and do
Reduce
more
the
reps.
weights, do the more. And if you feel your muscle is dilute, this is a very good approach. You can just do the little stretching, or you can just do like swimming or some kind of aerobic activities more for that days. And just if you want strength, I told you, like more repetition, less weight. But still, after doing that one, if you are getting a pain in that thing, if you listen to the good physiotherapists, they exactly know when to start. And I told you, you already told me about it, I want to do gym. So there is a balanced approach. Okay, and someone has to guide you which is right way and which is wrong way. Okay, as I told you, so that is a criteria. Okay, stop going a gym, it's not, it's a superficial statement. Okay, the deeper statement is means whichever the area which is not functioning well, ideally you should not do or do the stress in that area.
I want to take this a bit deeper. There's certain exercises in the gym which are very risky. Some exercises, for example, are deadlift. I think you would have seen multiple patients for neck, back issues because if deadlift is done in a wrong way, it causes a lot of issues, right? For both neck and back, even if your neck is not. What are these exercises that you see are the most dangerous in the gym and people have to do this with a proper supervision from your experience so that people are very careful when they are doing these 3 exercises or 5 exercises from your experience?
Okay, so I always go with the fundamentals. Okay, because no, if I'll tell you specific exercise, there are thousands of exercise. So what I usually tell the people, your body is meant for a movement. Always remember, you're not meant for sitting at the home, ideally at the office. You need movements, but always feel gradual approach. When your body is telling something is not right or not giving a confidence, try to avoid that. And when subconscious mind tell you, okay, this is okay, I can do it, automatically you can do it. But sometimes some people, like no, they are too much in your, like no, what I can say, the self-esteem, too much extra motivated, so they forget that limit and they do over things just to prove themselves. Okay, but if you see, if your body is intelligent, like suppose I'll give you the example. When I start jogging, okay, I hardly jog for 500 meters, but slowly I develop my limit to the 2 kilometers, 3 kilometers. Now I'm doing like 2.5 or 3 easily. So this is, your body is meant for that. So if you approach gradually, there is no harm. So there is no specific right or wrong exercises. Ideally you ask your trainer who's available in the gym or listen to your body. When you do something, just to sum up, if it's your body is telling, okay, I'm confident to do it, just go for it. And if you're feeling, okay, I have little resistance, just wait for a while, just try to practice the easy version and then try for harder version.
Thank you for sharing this, doctor. Finally, your advice to people so that they take care of themselves better. They live long, happy lives away from pain and suffering in terms of the neck. What's that final advice that you would like to give them?
Simple advice I will tell them. First of all, 3 to 4 things you have to remember. Ideally, your body is the most intelligent machine if you use it right way. And sleep well, eat well, and nowadays sleeping is not good. And third things, keep moving, okay, in a right way. And if you're feeling your body is not giving good vibes about this activity, try to stop for a while, just take some days and then do it.
Thank you so much for sharing that, Dr. Ravi. It's been a pleasure having you on the podcast. It's amazing to work with you.
Same here. You honestly, I will tell you some of the things which you, I'm right now telling to you, some of the things is there in my mind since long time, but I never had that opportunity or conversation with anyone that coming up or from the deeper layer it's coming out. So thanks to you as well for taking that all out for the people who might I can help.
Of course, and we just got started, Dr. Ravi, because I have a lot of problems. I have back pain as well, which we have not covered at all. So maybe we do another episode where we bring you in and we talk about back pain because that is another silent killer. We just discussed this episode. I wanted to make it very specific about neck, but maybe in the few months, let's see how this podcast performs. We can do another episode on back pain. I would love to invite you on the second biggest thing which causes me pain, which is my own back, and so that more people don't fall prey to these small issues. Anyways, thank you for being here, doctor. It's a pleasure having you here.
Same here, and thank you so much for having me as a guest as well, Neet.
I'm going to leave the links to your clinic. Okay. So this is for the people who are watching right now. If you want to go meet Dr. Ravi in person, go to Movement on Physiotherapy Clinic, the best clinic I've been to. It's made a huge impact in my own life. I'll leave the link, I'll leave the address, I'll leave the location, all in the description. Go meet him, go meet his team because they do an amazing job in treating you. 70% success rate is what him and his team had delivered, and that's massive. And he has cured multiple people with chronic back, neck problems. So if you're someone who's in chronic pain, if you're someone who just got an injury, you can go to Dr. Ravi and in a few sessions, he will treat you. And if you have had longer chronic pain, the chances of success are the best with him. With that, thank you for watching this episode. We hope you found value through this episode. Leave some other ways that you have been using in your own life to counter neck pain, or if you're having any other hacks, do let us know in the comments below so that it can help other people who are watching this episode as well. Take care. See you next week.